Dr. Sreeni?
Yeah.
Yeah.
So I'll be just walking through a few of the IOL implantation mishaps that can happen. This is a wrong powered intraocular lens that has been implanted. Can the audio be cut? So what I prefer to do is for explanting it, I cut the IOL. So before cutting the IOL, I normally put the IOL in the bag, and it's okay, sir. It's okay. It's okay. It's okay. I put the IOL in the bag, and so that the PC is supported, and cut the IOL to about 1/3, and using the cut area as a fulcrum, you take it out. This on implantation, you can see that part of the IOL is not there. In those cases, you don't have to do more of cutting. Just extend the section a bit and bring it out. So this is a common thing that happens with the Indian-made hydrophobic intraocular lenses. Lenses are good, but the injection system is not great. So just pulling it out will definitely damage the IOL. So what I do is I just keep rotating it, and it just comes out most of the time. And here again another case in which it's stuck in the cartridge. You push it, it doesn't go. So how hard you push, it doesn't go, because you can see that the soft tip has come out to the hard this thing. So you can identify an area where the optic is not there and cut the cartridge with a sharp blade. Then you can actually safely take out the IOL. And see, the problem here again, implanting, is that in hydrophobic, it is all folded, so it takes time to redo it. So this is hydro implantation. I use a 23G needle for the fluid, but if the fluid is not directed properly, it can hit on the IOL, and the IOL can actually flip. So once it is flipped, it's not safe to reflip it under the irrigation. Put viscoelastic, then you can put it in the right orientation, and put the IOL in the bag in the correct way. Here another case where the IOL has sort of started flipping under hydroimplantation, but it's not really flipped. Then it can be reoriented under irrigation only, and the IOL can be placed in the back. So when it is hydroimplantation, the direction of the flow of the irrigation is very important. See, this is first post-op day. It's a sort of a sinking IOL, right? So but I knew that there is no PCR or anything. So you can see what has happened. So the IOL haptic, the optic haptic is there. So many times you see it and you feel that later on it's in the bag, later on it is going to come back, and it will stay in the bag. But occasionally it might get stuck there. So in that case, you will have to take it back and separate it. You can see how much force is required to actually separate it. So this is post 1 month post-operatively, 6/6 vision, but the patient has high IOP and pigment dispersion. There is pigment on the IOL, pigment in the AC, pigment in the anterior vitreous. So see, as you gain experience, I mean, you tend to be more adventurous, and I tend to do cataract surgeries without pupil expansion, even in pupils as small as this. The tricky part is cortex wash and the IOL implantation. Here, because you can see that IOL is going in smoothly, it has gone into the back. So in this case, it's 6/6. There is no refractive error. You do an anterior segment OCT. What can you see? The IOL is in the optic is in the back. One haptic is outside, and that is there, pressing on the posterior surface of the iris, causing the pigment dispersion and the high IOP. So the next time I took the patient, I was not injurious. I put iris hooks to have a proper visibility. This is important. 1 month I took it up about 2 months post-operatively. I was hoping that everything will be fine. Then only I realized something is actually wrong there. So you can see this has to be, so 2 months it gets stuck a little bit, but with care you can actually bring it out and put it into the bag. So the optic haptic getting stuck, and so this was IOL was in the bag. It was haptic was folded, and later on that actually went into the sulcus. So you have to be not take this lightly, that optic haptic this is post-operatively everything is in the bag, and within 3-4 weeks everything settled down. The pigments went off and IOP came down.